All right, today's Wellness Wednesday report is about breast cancer. I know so many of you know that October is Breast Cancer Awareness Month, and according to the CDC, more than 264,000 new cases were reported in 2019. And here in Ohio, there were more than 10,000. Well, Dr. Hallie Moore, the director of Cleveland Clinic's Breast Oncology program, is with us now. Breast cancer, I think what we need to try to keep in mind, and I only know this because I've seen it happen to some people, it's not a death sentence anymore, yes?
That's very true, and particularly when identified early.
Okay, so talk to us about what we need to be doing to make sure that we can have early detection as part of our process.
Sure. So screening for breast cancer is basically looking for it before you have a symptom or a problem. So people who are otherwise healthy, most women age 40 or older should discuss with their doctor what screening is appropriate for them. Typically, that would include an annual mammogram, and that's one of our best tools for detecting breast cancer at its earliest stages.
So I know Katie Couric was just talking about this because when you go to take your mammogram, there are some of us, and I believe I'm one of them, where the tissue is so dense that you require more. As a doctor, it's my assumption that you would recognize that during the test.
So the radiologist will always report the breast density.
Okay.
So you will know when you receive your mammogram report what the level of breast density is. And many people have dense breasts. It's very common. Some people have extremely dense breasts, and that can really limit the ability of the mammogram to find things. So depending on other risk factors and other findings on the mammogram, additional testing may be appropriate.
Okay, so once we get through the testing process and the screenings, what kind of advances are you seeing in treatments now? Because we know how much research goes into this.
Yeah, so there have been many advances in breast cancer treatment at all stages. And one of the themes that we're seeing is really our ability to individualize treatment. So we're better able than ever before to identify those higher risk patients who need the most aggressive treatments versus those who can be spared the more toxic treatments. I think Katie Couric is a good example. She had genomic testing done on her tumor that was able to classify her cancer as one that's likely to respond to hormone-based treatments and does not require chemotherapy. So more and more we're able to individualize the most appropriate treatments for the right patient.
So when we look at the hierarchy of treatments in terms of what is least invasive, hormones are part of the treatment plan?
So it's actually hormone lowering or hormone blocking treatments that can often be used for hormone sensitive breast cancers, yes.
Okay, that's what I wondered, because we also talk a lot about hormones with women anyway, because of many different things, with stress and with hysterectomies and with all kinds of things that happen. So when you mentioned hormone, that kind of stuck with me. Thank you so much for your expertise and for sharing it with us. We appreciate it.
You're welcome.
We know how important it is right now. So listen, as many of you know, our very own Danielle Wiggins battled breast cancer, and all this month on Go, she's introducing you to people impacted by cancer and local organizations that are set up to help. So tune in tomorrow at 6 a.m. There's our beautiful Danielle. She's going to teach you more about an organization called My Sister's Keeper. It helps any woman who is diagnosed with cancer. Stay close.